about cognitive restructuring. It is an important technique used in cognitive behavioral therapy and in other therapies. The aim of cognitive restructuring is to change unhelpful or irrational thoughts into more balanced and accurate ones. So how does cognitive restructuring work? There are 4 stages. In the first stage, identifying the negative thoughts or the irrational thoughts. The second, to challenge and dispute these negative thoughts. The third stage is to replace these negative thoughts with positive ones. The fourth and final stage is practicing the new thinking patterns. So let's take the first stage, that is identifying negative thoughts. So in CBT, the therapist helps the patient, also called the client, to identify their negative thoughts. Now, let me give examples of negative thoughts. Magnification of events. Sometimes people magnify or blow out of proportion certain incidents. For example, she ignored me at the party, so she must hate me. Another example of negative thought is overgeneralization. That is holding extreme beliefs on the basis of one incident. For example, I did badly in the test, so I'm sure to fail in all the tests. So after identifying the negative thoughts, move on to the next stage, that is challenging and disputing these thoughts. How to do it? By examining, looking at evidences which support these negative thoughts or which are against these thoughts. And then look at alternative, realistic ones. The third stage of cognitive restructuring is replacing these negative thoughts with positive ones. And the final step is to consistently practice this new thinking pattern so that it becomes a part of a healthy thinking style.